Also insane is what Republican Representative Raul Labrador from Idaho said. He voted for the repeal of Obamacare and the replacement of it with iteration number 2 of the American Health Care Act. The day after he voted for the bill, he had a town hall at Lewis Clark State College in Lewiston, Idaho. During a question and answer session, a woman stood up to speak, and she criticized the new bill because of the major cuts that it would make to Medicaid, saying this is telling people to die. What did Congressman Labrador say? Nobody dies in the U.S. because they don't have access to health care.
You are mandating people on Medicaid except dying. You are making a mandate.
No one wants anybody to die. You know, that line is so indefensible. Nobody dies because they don't have access to health care.
You can hear the crowd's disbelief there. So, number one, Labrador is wrong about no one dying because they don't have access to health care. But the number of other countries that have figured out a way to prevent people from dying because they don't have access to health care makes it clear that we could also do that in the United States. Labrador is not the only guy who says stuff like this. In a 2007 event in Cleveland, Ohio, George W. Bush said, quote, "The immediate goal is to make sure there are more people on private insurance plans. I mean, people have access to health care in America. After all, you just go to the emergency room." We all remember, or many of us remember, this Mitt Romney interview from 2012.
Well, we do provide care for people who don't have insurance. People, if someone has a heart attack, they don't sit in their apartment and die. We pick them up in an ambulance and take them to the hospital and give them care.
Why all this talk of emergency rooms? Because after this incident, Labrador was asked to defend what he said. And what he claims to have meant by nobody dies from lack of health care is, if you go to the emergency room, hospitals have to treat you, okay? And many Republicans have pulled that line out. Breaking news, people going to the emergency room without health insurance is part of the problem we have. That's part of why it makes more sense to make sure everybody is insured so that they can go to primary care and not go to the emergency room for primary care, bills which they will often not pay because they can't afford it, which then are just priced into the premiums that people with health insurance actually do pay. How is saying people go to the emergency room and they have to be treated part of the solution to the problem? It is the problem.
Yeah, that's the thing. I mean, they're not going to deny you care on the spot, but you have to pay for it in the end. And
Yes.
62% of personal bankruptcies in the United States come from medical expenses. That's a problem that really doesn't exist in other countries.
Correct.
And so if you have to make the decision between paying for your own medical care and being able to leave some money for your family and not burden your family, you may choose the latter.
A 2009 study by the Institute of Medicine found that uninsured Americans are more likely to die if diagnosed with a number of illnesses, including but not limited to cancer, congestive heart failure, diabetes, heart attack, etc. Also, people without insurance are more likely to be diagnosed with a more advanced stage of cancer because they understandably have not been keeping up with primary care all along. The list goes on and on and on. A study from the same year, 2009, published by the American Journal of Public Health, found that about 45,000 deaths every year in the United States are linked to lack of health coverage, and that working age Americans without health insurance have a 40% higher death risk than those with private insurance. One of the study's co-authors, Steffi Woolhandler, a professor of medicine at Harvard Medical School and a primary care physician, noted that, quote, "Historically, every other developed nation has achieved universal health care through some form of nonprofit national health insurance. Our failure to do so means that all Americans pay higher health care costs and 45,000 pay with their lives." That means that we can say that at least around 20,000 Republican voters will die this year because they don't have health insurance, roughly half of that 45,000. Here's a 2015 study that examined healthcare in the U.S. versus healthcare in 12 other developed countries with universal healthcare, or governments that ensure basic provisions of the basic provision of health services. Not only do all these other countries each spend far less on healthcare, they have better health outcomes and longer life expectancy. The U.S. has almost double the average infant mortality rate of all these countries, and the U.S. has the highest mortality rates among people with diseases like heart disease and diabetes. Nobody dies because they don't have access to health care, Congressman Labrador said. It's not only flat wrong, it seems to be the position that Republicans are taking when they make healthcare policy, and it is flat out immoral, never mind being completely incorrect. Again, Labrador responded by saying, quote, "I was trying to explain that all hospitals are required by law to treat patients in need of emergency care, regardless of their ability to pay, and the Republican plan doesn't change that." Right. Labrador.house.gov. It very clearly lists Congressman Labrador's contact info. Let's take a break. We'll be back with more right after this.